Welcome everyone to our third annual MSK Week, which is full of inspiration, relatable conversations, and Black women prioritizing their health. This year's theme will focus on prioritizing mental health in the areas of prevention, care, and well-being. The virtual panels will feature, conversations around the importance of community, the mental health workforce, navigating chronic illness, and advocating for reproductive justice. My name is Janae Epps, and I am the Senior Director of Reproductive Justice Initiatives here at the Black Women's Health Imperative. I oversee amazing programs like My Sister's Keeper, affectionately known as MSK. This evening's panel is entitled Sis, We Got You, because we do. Insights from mental health professionals. This panel features young mental health professionals and advocates, specifically focusing on the mental and emotional toll of working in the mental health field and carrying other people's trauma and grief. The panelists will share their experiences, tips, and resources for maintaining good mental health while working in demanding and often emotionally challenging fields. I'm going to start by introducing our amazing panel today. First up, we have Brianna Baker. She is a fourth-year doctoral candidate in the Counseling Psychology PhD program at Columbia University. Born and raised in North Carolina, she graduated from the University of North Carolina at Chapel Hill with an undergraduate degree in psychology and African American community health and resilience. Her research interests broadly include socio-political determinants of mental health, positive Black family development, and ameliorating socio-historical racial trauma through community-focused program development. She is a current Robert Wood Johnson Foundation Health Policy Research Scholar and an American Psychological Association Pre-Doctoral Minority Fellow. She hopes to mesh her passions for communications, public health, and psychology to bring African American mental health to the forefront of America's social, moral, and political agendas. Brianna is the co-founder of Black and Mental Health Initiative and the founder of Girls Reaching Optimal Wellness, a school-based mental wellness program for young women of color in Southern USA. Known for her courage and outspokenness for Black mental health, Brianna's commitment to mental health equity has been featured on Spectrum News, Refinery 29, WebMD, and other prominent media outlets. Welcome, Brianna. Next up, we have Mbacha Mbinga. Hi, Mbacha. Mbacha is the eldest daughter of Gambian immigrant parents and a DC native. She received her BA in Children and Youth Studies from CUNY Brooklyn College. And in May of 2022, she received her MA in Rehabilitation Counseling from the University of the District of Columbia after completing over 700 clinical hours and being inducted into Chi Sigma Iota International Honor Society. For the past 9 years, Mbacha has used her advanced training in early childhood educational support and youth advocacy in New York and Washington, D.C. For the past 3 years of Mbacha's mental health practice and advocacy, it has involved using clinical techniques to provide counseling services to children, youth, returning citizens, LGBTQIA plus identifying individuals, and adults in a variety of community and private agencies. Mbacha's approach to therapy is holistic and supported by a solid variety of evidence-based practices such as cognitive behavioral therapy, gestalt therapy, pronunciation check, and relational cultural therapy. Sorry, y'all. Mbacha has given speeches at the United Nations on education and equality for women and girls, and the school to prison pipeline and how it affects Black children in the education system. Mbacha brings experience of evaluating the social and emotional development of youth and adolescents, mostly from marginalized communities, all while displaying cultural competency and community engagement. Mbacha is a food blogger, and she enjoys exploring restaurants and foodie spots in the DMV. Her goal is to help instill the focus of wellness by promoting inner bliss with mental, emotional, and spiritual support. Next up, and certainly not least on our panel today, is Quadacia McElwain.
Hi.
Quadacia is a native of Charlotte, North Carolina. She is duly licensed. She is a duly licensed mental health therapist, business owner, and self-published children's author. With over 7 years of experience providing therapeutic services to individuals, groups, and families related to mental health and managing day-to-day stressors. Her passion is working with youth and adolescents in the field prompted her to open her nonprofit organization, License to Heal Project, which promotes mental health awareness, advocacy, and empowerment to youth and adolescents, teaching them the power of healing. Quadacia is currently finishing her Doctor of Social Work degree from Walden University and is excited about continuing to promote positive social change. Welcome, ladies.
Thank
So
you.
I am super excited to have each of you here for this conversation tonight. Before we start, I want us to check in really quick. So I'm going to put up the emotion wheel. And I want you all to take a look at this emotion wheel and check in, see how you're feeling today. And I would love for those of you that are in the audience to look at this wheel as well and let us know how you are feeling. Put it in the chat so that way we can see it. So I'm going to give you about 15 seconds to pick a word of how you're feeling today. Perfect. Let's just go ahead and put it in the chat. And then I'm going to circle back with our panel to see what word sticks out for you today and how you are feeling. The wheel will disappear at some point. But while we are waiting for the wheel, okay, perfect. Folks are checking in the chat. That is perfect. So I'm going to go ahead and start with you, Brianna. How are you feeling today?
Yeah, I think I'm feeling curious. That was the word that popped out to me the most. I'm feeling curious, especially after hearing these bios. I'm really curious about what this panel is going to bring and also what insights are going to be made. So I'll go with that one.
Yes, Mbacher.
I'm inspired. I am very excited about just learning about what everyone is bringing today. I'm very excited about the people that are in the chat, but I'm inspired. I really support the MSK program, so that's the energy. That's what I'm feeling right now.
I love that. Quadacia, how are you feeling?
Honestly honored to be here with you guys on this panel, hearing your bios. We're all amazing African American women that are making positive social change in the community, and in the world. So just honored to be here with you guys, and excited to hear your insights as well.
Yes, and I feel excited. Okay, I'm super excited for this panel and this conversation. I'm checking into the chat. I'm seeing folks saying they're feeling overwhelmed but accomplished at the same time. That's okay, sis. We sending you love. We got you with these good insights today. Folks are feeling accomplished, brave, and appreciated. So I love that. Oh, feeling hopeful. Yes, I love that. So I'm hoping that as we are in conversation today, that you all leave with something from these amazing women and can pour out in the chat as well. So I want to kick us off with the question, what is the current state of Black mental health from your perspective? Popcorn, anyone can answer. And I know it's loaded, but
I'll pop in first. I would say that the current state, so I'm all about duality. I think that two things or multiple things can be true all at the same time. I think currently the state, particularly for the Black community, I think that we are in a state of inspiration and encouragement. Because I mean, mental health just in general is really becoming popularized, which is a good thing, right? Because more people are becoming comfortable with advocacy, suggesting therapy if they've been in therapy. But then I also think that there is still some room for improvement, right? But spaces like this, we can start small, because a lot of times I'll find that many people are inspired by other people who have been to therapy, even if you just did an intake, right? And again, you have to start somewhere. So I look at it two prongs in that sense.
Yes, love that, Mbacher.
Absolutely. That was good. I want to piggyback on what she said. You know, with the celebrities, a lot of, African American celebrities, females like Taraji P. Henson, are coming out about mental health. And so I think that that's creating a space for other African American women and just the African American culture in general to say, hey, it's okay. It doesn't mean that I'm crazy just because I'm going to talk to someone. And we're kind of getting rid of that mindset of, oh, nothing's wrong with him or her, or just go pray about it, or some of the things that were swept under the rug back in the day. We're kind of getting rid of that mindset, and more people are coming out and seeking therapy in the African American community. So I think I agree, there's room for improvement, and it's definitely increasing at this point.
Yeah.
Yeah, exactly. I mean, retweet what y'all just said, especially about this duality piece. I think, yeah, a lot of people are now talking about therapy or talking about mental health, which is great. And I also think that that process, we're as a collective beginning that process of healing. And I think that makes us go through a process of grief and grieving what's happened to us in the past. And so I'm hearing a lot more conversations about that as well through the mental health lens. So it's this kind of bittersweet experience of having to really recognize the fact that we have been harmed and we've been disregarded in society, and that our psychology or our psychological experiences have suffered because of it, but also seeing this as an opportunity to rise up, to seek wellness and seek healing finally. So
Yes, thank you all for answering that. We are in a current state of inspiration, but then also collective action, processing, but then also healing. So that's very important. So knowing that that is the current landscape, I want to check in with each of you and ask you what inspired you to pursue a career in mental health, to sit through school for how many plus years. I hear doctor, I get some doctoral candidates on. So, what inspired you to really step into this field? And this is going to be popcorn, y'all. I don't want to put nobody on the spot. So whoever wants to jump in.
Okay, I'll go first. For me, coming from a family that is well rooted in foster care and adoption, growing up, my grandma did foster care. My mom was a foster parent, so we had the foster kids in our home, and so I saw, the way they cared for those youth, and always connecting with social workers and seeing how they help these youth. That kind of prompted me to want to become a social worker. And then once I became a social worker, when I got my MSW, working in the field, seeing clients daily struggling with mental health, depression, anxiety, just adjustment, all of these things prompted me to say, I want to do more. I want to help these individuals in a different way. And so I said, well, maybe if I become a therapist, working, more deeply in the mental health field, I would be able to help on a bigger level. So for me, that's why I got into mental health.
I love that.
yeah, for me, I think I really drew on a lot of the experiences I had when I was younger. So, like I said, I'm from North Carolina, but I'm from a more rural part and from a pretty homogeneously white community. And so, growing up, I remember just having so many feelings of what I would now classify as depression, but not knowing it then. And of course, my parents not being able to pinpoint what it was that was going on, but just feeling isolated, feeling ugly, having very low self-worth and self-esteem, things like that. And so, I think what's propelled me to keep going on this journey is constantly reflecting on who I was then and what I would have needed at that time. So that has really pushed me forward in all these years of schooling. both in research and now in clinical work as well, as I've started to get more involved in seeing patients and being able to help on the day to day. I really enjoy that. But just getting to, I think, help that younger Bree is something that pushes me to keep going.
I love that. The younger Bree. Love that. And Boxer?
So I have a background in education, and I feel like if you are a teacher, if you're a nanny, if you work with kids, if you work with youth, you are always doing some type of mental health work. But in full transparency, I had quit my job in 2018, and Black women, I'm just like, I'm going to grad school. So I knew that I wanted to stay in the helping field. I didn't want to particularly do psychology, but I knew that rehabilitation counseling is something that I'm like, okay, I've worked with young people who have had special needs before. I've done these kind of things. This sounds like the best fit for me. And I knew that there was a wide variety of things that you can do with a mental health degree, right? Um, so I just I feel like I wanted to find my niche somewhere. I went through a different variety of programs to see what fit. I read the course descriptions, and then I found my program. And it was just a good fit. I was just like, you know what, this is something that I want to do. And again, I was inspired by the different options, right? Like you don't just have to be a clinical therapist, or you don't just have to be a school counselor or these things. So there were also options that were, pretty hopeful for me as far as like what it was that I could do into my like adulthood.
Yeah. So I love how when it comes to like education, it's like, okay, I started here, or it was like that personal experience that started with you or your family or your circle, what inspired you to go into this field and figure out like where you wanted to land, which is so important. For me, of course, I'm public health, right? But I love talking about mental and emotional health. Where I'm helping y'all on the other side. So I'm a mental health first aid instructor, and so that has been really helpful for me, teaching folks about mental health first aid, and teaching them the difference between a mental health challenge and a crisis, which is very important. So thank you all for adding that. Talk about what inspired you to get into your respective places in this mental health field. And we all know, like, you get excited to be somewhere, right? You get excited to do the work. I know we're all excited to do the work for our people, and right, for that collective action. But what are some of those unique challenges that you have faced or are currently facing right now in your field?
I think for me, it's a lot of it is the structure of even what therapy is. It's something that I'm trying to like negotiate and renegotiate. And I'm still in school and I'm still learning. So a lot of this is new and I'm still trying to like figure out, what feels right to me. But this idea of, okay, 50 minutes, you're going to get to know somebody very well, their most intimate secrets, their desires, who they are. And then at some point, that relationship is going to break and it's going to end. And you're not going to continue on, getting to see that person. You're not going to know how things turn out. We have ethics, we have codes that we can't have a relationship afterwards. And I think for me, I didn't realize how much of a challenge that would be. Getting to be in this position of helping, but also in a position of giving someone tools so that they can leave me as a person or me as like a therapist. So that has been a really unique challenge. And I have worked in college mental health this last year. So very, very short-term model, say maybe 8 sessions max. And then just, the work's not done, but you have to let them go. And I think that is a very unique position that therapists find themselves in.
Yeah. Not enough time spent.
No.
Yeah, I agree with that, Brianna. That was my challenge as well. Just the connection that I have with my clients, and just having, whenever it's time for them to graduate or terminate services, you're still always thinking about in the back of your head, like, how is such and such doing? I hope they're using their coping skills, And so I think that's a challenge for me, learning to separate, the two, my own emotions with, the clients.
Yeah.
That's very real, especially when you get so excited about just growth, even if it's something small, right? For me, for certain things, I would say certain exposures to like certain triggers or even stressful moments. If you have like a heavy caseload and you deal with personal things and family, and then you have to also know how to show up for your clients. And sometimes client resistant to change can be a unique challenge. It's not necessarily a bad thing, but if you've ever been in therapy and just as Brianna mentioned, you are bearing your soul and a lot of things, right? It's not easy to adjust to change, right? Even if it's just changing a habit, right? So like something like negative self-talk, sometimes there can be resistance, even when you check into the things that you may have experienced yourself, right? But when you learn and work on trusting yourself and kind of echo that to your client, you can always grow from challenges. And then also the last thing I would say is sometimes having opposing views from your client, right? You have to be very, very mindful of what is appropriate for your role. And then also, it can be so conflicting sometimes just having your own personal views and having someone that you really care for. You want to see this person succeed and change and grow and all these things. But that can pose unique challenges sometimes.
Yes.
Yeah. I love that you brought that up in Botcher because I hear folks, I hear a lot of conversation, right, around once folks get into therapy, right, and they meet a therapist, and let's say the therapist doesn't work out, then they have to go and find someone else. And so people liken that process to dating. So I would love to hear from each of you. Like, what's that conversation been like for you? Have you had that conversation with your colleagues? Are you also dating the client as well, like trying to figure out if they're going to be a good fit, right? Opposing views, will this work? So just want to hear a little bit about that from each of you.
Yeah, I'll start. I definitely date with my clients. Within by the end of the first session, in your mind if it's a yes or no, and I know in my mind if it's a yes or a no, because I am very direct, and so I lay out the expectations. What I expect from my clients during the first session, and then I also allow them to say what they expect from me or what they're hoping to get out of therapy, and if that's something that I'm able to assist them with or not. If I'm not, I will just say that and then try to refer them to someone else. But I think yes, during that first session, building rapport, we're kind of dating, and seeing if we like each other.
That's real. Any thoughts, Brianna and Butcher, about that piece?
I mean, it's funny, like being in school, it's not like dating, I guess, because you get what you get. It's like arranged marriage. It's not like dating.
See, I haven't heard that one yet. So yes, arranged marriage, yes.
And sometimes it ends up in divorce. Sometimes, I mean, like your clients will, like, they'll ghost you. But I mean, I think what Quadacia was saying about like being very clear about expectations is very true. From that intake form to the end of that first session, it is very much like, is this going to work out? And also it may take like 3 sessions before you even know if it works or not. But I would say that I guess it is like a dating process, but in my case it does feel a little bit more solidified, just because I don't have a say just yet.
Yeah.
I'm thinking back to my practicum and internship. Like, yep, it was giving arranged marriage because I mean that's true. When you start out, it's just like this is what you get. All right, we'll talk about it in supervision. But I definitely agree, and it's also kind of like figuring out what you like. When you're dating, if you don't want to date someone that's like not generous or cheap, right? You don't want a therapist that's gonna, be even back to what I was saying about like personal views. Like I remember my clinical supervisor telling me like you should also be asking questions too, because you kind of want to know what she might think or feel about like your spiritual practices or your favorite food being a certain, stuff like that. So I agree with everything. Yes.
Yes, you definitely have to be relatable. you know, to your client. Nobody wants a therapist that cannot relate to what they have going on,
Yep.
or just something similar. We all become therapists for some reason. Maybe it's something we experienced or past trauma or whatever. And so we can use those things to kind of connect with the client. And so if you think about it from the client's perspective, coming into a therapist's office, or us as therapists, because I go to therapy as a therapist, and going in there, and if I had my therapist like, no, I never been through that, or I can't relate, I'm not gonna want to, continue that relationship. So being relatable too is important.
Yes, I love that you brought up the relatability piece. I think when we think about the mental health workforce, there's an influx, right? You all are in high demand right now, right? And everybody wants a Black woman therapist. And we know what that equates to, right? Overbooking, not having any openings to see folks, and that can be disheartening and can deter folks from navigating. But then there's also this thing where people want very specific folks, right? The relatability piece, right? Like, I don't want, I want a Black woman, right? But she can't give grandma. I needed to give big sis auntie, because I need us to be able to connect, right? I need you to be just old enough to have had some experience more than me, but still be able to be relatable. And I hear that in conversation a lot with folks, right? The relatability piece, but then also knowing that Black women are in high demand to be seen. So just want to hear from you all. And Brianna, I know that you are a student at this point, but you are seeing folks as part of getting your hours. Quadation and Bacha, you all are in the field actively and seeing folks. So just want to know from you, what is that like? What has your workload or caseload been like, especially, COVID is subsiding, right? I guess the public health emergency did or whatever, but we know COVID is still real. So how has that affected your caseload?
Okay, I'll go. So for me, during the pandemic, my caseload kind of doubled, because so many people were having a hard time adjusting to the changes that were occurring, because everything was so unknown. And it was hard because just as it was unknown for them, it was, I didn't know what was going on either. And it was like, I have to show up for them and show up for myself, even though I don't even know. It's uncertain to me as well. But so my caseload kind of increased just with people with anxiety. And this is working in private practice, as well as at that time I was working at a local hospital here, a behavioral health hospital here for youth and adolescents. So anxiety, the kids were out of school, parents having to stay home to help them with their homework or do the online schooling. Child abuse and neglect rates increased. I mean, oh my gosh, like everybody was in like this turmoil. And so I think for me, my caseload kind of doubled. Um, I don't know about you guys.
Mm-hmm.
So during right at the start of the pandemic is when I started my practicum. So it was just like, you cannot see your clients in person. Everything is going to be virtual. And there's also like a big influx of mental health practitioners that, I mean, for 2-3 years, we're doing everything virtual with their clients. With younger people, just to Quadacia's point, there was a lot of need for social emotional learning, and even just like basic companionship, right? Because the separation, and especially for young children, not having those social interactions, it can be a lot, right? But I mean, I had really great professors and a really cool cohort. So even though the struggles were struggling a lot at times, it was nice to be able to have that support. But it was definitely different, especially during that time with a lot of adjustment disorders as well, for myself. And again, just the anxiety, the depression, the immediate shift in just like a lifestyle change, it shook a lot of people. and myself too, and family, and just adjusting to a lot of different things. So it was kind of like the things that you experience individually, and then also like you're vicariously kind of like living through and experiencing things that your clients are dealing with. And yeah, it was a lot.
Yeah, I was able to work in community mental health and then again at the College Counseling Center. And I think the most interesting part of it for me, especially just thinking about COVID in general and how that's affected mainly like emerging adults, is now we're at the point, we're in 2023, where so many students experience COVID at the beginning of college, like at the beginning of adulthood. So 18 years old, not really knowing how to navigate things. I live in New York City, so people moving from small town USA to New York just to be hit with COVID, and then trying to figure out like, what is this place that I'm in? This place that hit really hard. Now I'm in a dorm. I can't be in the dorm. I have to go home. And all of that, as Mbacha and Quadesha were saying, like a lot of adjustment disorder, a lot of anxiety, and a lot of depression. And that very chronic, persistent depression in a lot of the college students that I'm seeing. So I would say that that's probably been what my caseload is like. And also I work at a fairly small college, but we see about 2/3 of the student body, our center does. So it's really an increase in demand for services and an increase in demand for long-term services because we can only do so much.
Right.
So people needing care, substantial care, is something that I've seen, especially in that emerging adulthood range.
Yeah. Okay, so you all have been busy, booked and busy, okay, and doing what you can for the allotted time that you have with folks. And you know, as we think about how the field can advance, think about those long-term options for folks that may need more than 6 sessions, right? We think about employee assistance programs. I think most programs, I think it's what, 5 or 6 or something like that. And I know that can create challenges for folks when they need more. Um, so I want to go back to a topic that we kind of covered in the beginning. What most of you talked about is the social media piece, right? So I know in the height of COVID, folks are at home, folks are on their phones, receiving virtual assistance, but there's been this trend where folks are on social, right? And they, you know, therapists, mental health professionals, you know, you all are on socials as well, giving advice and things like that. And sometimes it can be hit or miss with social media because everybody's self-diagnosing themselves with TikToks and things like that. But my question that either of you can answer or all of you can answer, how has social media been helpful and how has it been harmful to folks' mental health?
I think that there's kind of always going to be a general piece of social media that can be harmful. And just the other day, I was talking with my sister about, I was like, back in my day when we were on social media on like MySpace and stuff, they had these like anonymous chat rooms, and sometimes it could be really heinous, right? But it's evolved a lot. It can be harmful just because negative energy can fester anywhere, right? And you just don't know what people have a lot of time on their hands, and I think that's the harmful piece. But the helpful piece is that there are qualified individuals that use their platforms to maybe debunk stigmas that surround mental health. Like there's one page I follow on TikTok, and she specifically talks about OCD and like, these are myths, this is what is true, this is what this is what it's not. There's a girl on TikTok who talks about Tourette syndrome, right? Like real stuff. So I think that the people that live with these conditions, disorders, they also can help people to kind of normalize them, right? And people are also using their platforms to just kind of talk about, okay, well, this is what it looks like to be a Black woman with high functioning depression, right? Anxiety can show up this way, that way, this way, that way. So those helpful pieces, I think it goes back to what we talked about before. it does provide those moments of like inspiration, or like, okay, this is an actual licensed therapist who's, doing like an Instagram live and sharing these things. Let me go to her psychology profile and see if I can book her, stuff like that. I think those are the really helpful pieces. And then also, like, it's just becoming so much more normalized, even though sometimes, and I think more so for millennials, because we can use traumatic things and kind of make them a joke, which we'll talk about in therapy. But I think that more millennials are also just kind of like, child, the anxiety, the depression is beating me up, but everyone collectively is just kind of like, oh, me too. What do you do to help? Or this is a page that I like. This is a YouTube page, or, those kind of things. So I love to see that, that just that spike in like collective, we suffering, we can try to make something, right? We're going to take these lemons and make lemonade. So, yeah.
Yes, I'm a millennial and I'm a meme girl. Okay, so anything, any meme related thing, I'm like, yes, me, repost, repost. I'd love to hear from you, Brianna, Quadesha, about what's harmful or what you think is helpful in the
Yes,
media realm.
I'll go. So I agree. Helpful is like the people that are the professionals that are on these social medias that are giving out helpful information, education, regarding, like there's somebody on Instagram, the period doctor who's talking about, women having their periods and all, mental health, other therapists that are giving out, these are the criteria for this diagnosis, that type of stuff is helpful. I would say harmful in a way of if someone is giving out like misinformation on these socials, right? Or like we said, when we are making a joke about it, because there are TikToks that I've seen or that I've done that are, supposed to be funny, or we see them as being funny, but for somebody who's suffering from that, situation or diagnosis or something, it could, be more harmful or be more seen as harmful. Also, like social media now after the pandemic, it was before the pandemic too, but especially since the pandemic, seems to create a lack of social interaction between like people, millennials and stuff like that. Everything is virtual now. Everybody's able to hide behind a social media profile, or, and I think that part is more so harmful because it's causing a lack of people being able to know how to interact with each other outside of technology. Or just like in therapy sessions, when I'm doing a virtual session or, versus an in-person session, those two look very different. I'm having to work a lot harder during a virtual session to try to build rapport with you, or as a youth to do an activity with you, because we're looking at each other over a screen. So those type of things, the lack of social interaction would be the harmful part for me, but that's me.
And the bots.
Oh my gosh, right?
Yes, the bots on social.
Yeah.
Brianna, I know you have a great social media presence, and so would love to hear from you. I was been that.
I love social media because of the reasons that y'all highlighted, of just being able to increase the national or global discourse around Black mental health, especially working with college students, working with high school students. Like, they're coming in already knowing about so many of these different disorders, so many different phenomena that I didn't have the words for when I was that age. Also just investing in themselves and just a whole new way of thinking, which I don't know if that's just like a Gen Z, like new age thing that's just their way of doing things. But I do think a lot of it comes from what's posted on social media. But then I think that there's also a lot of harm as well. I think, as Quadacia was saying, being able to hide behind a screen, that comes up often, especially with the college students. So-and-so's profile looks like everybody in college is having so much fun. Why am I not having so much fun? And then sometimes I'll look through their social media with them on in session and be like, well, this looks like fun to me. Like, why is it that you're feeling so disconnected, or that your life is so different than these other people? And it is this ability to kind of create and hide behind these profiles. So I would say that's definitely a harm. And the other thing that I've been seeing is a lot of influencers, so not necessarily professionals, giving the advice that their therapist told them. And kind of taking tidbits of therapy or tidbits of mental health professionals' words and almost twisting them or conveying them in a way that's actually harmful. And because people look up to influencers, especially thinking about Gen Z or millennials, it can do a lot of harm.
Yeah, I'm so happy that you brought that piece up too, Brianna, around the influencer piece. And folks probably took psychology 101 in undergrad, and now they're on social thinking they can say something. Or I've seen in like TV shows or movies where one person, the friend may be going to therapy, so the other friend is going to therapy through that person, right? Like, actually, I don't know if you've ever seen, what's the show called? How I Met Your Father. And the friend was going to therapy, and so they were asking her questions to ask the therapist. But you see that, right? When therapy is an individualized experience. And I think, some tidbits that are generalizable can be shared, but if it's something specific, I think that's where folks can be harmful in how they disseminate that information. So we done talked about the field, we done talked about everybody else and how y'all support them. We're gonna talk about y'all and your personal lives in doing this work. I know, sometimes as Black women, we do everything for everybody, and we're the last to receive the support that we need. But I just want to shift gears and ask each of you to speak about the emotional toll your role as a mental health professional carries, especially as you're interacting with different folks that have, different levels of trauma, experiencing different levels of grief. So just wanting to know, like, with that, how much of an emotional toll is it taking on you? But then how are you managing that emotional toll in doing this work?
So for me, as I mentioned earlier, having a hard time separating, my personal feelings sometimes, or just empathizing with someone else. So, I am often triggered by something my clients may say, or, an experience they may have had in the past, or past trauma that I've experienced as well. Or even, just grief and loss. We've all lost somebody, and remembering that grief and loss is not just someone dying, but loss of a relationship, loss of a friendship, loss of a pet, all of those things. You go through the grieving process. So I'm often triggered, but I just try to remind myself to just be present in the moment, and that we're here for them in that moment, and to remove myself and my own personal thoughts and feelings for them in that moment. Now, I might cry after the session, but in that moment, I, remove myself and I'm there for them. And then I also go to therapy, like I mentioned earlier. So I'm processing it with my therapist after the session, saying, hey, this triggered me. What can I do the next time when a client is telling me of some trauma? What can I do to for my own self-care in that moment, so that I'm being the most effective, therapist that I can be for them,
Yeah, I love that. Therapists need therapists too.
Yes.
Yes, that was very beautifully said.
Thank you.
For me, as far as like maintaining my own mental health as a mental health professional, is just as important as like maintaining my daily hygiene. And I say that because every single moment there can be something new. And again, just to Quadacia's point, it's so important to be able to know, or it's important to be able to identify your triggers, because you never know when something can trigger you in a session. There have been times where even just an intake just depleted, right? Supervision is so important for me because, clinical supervision, one, to just be able to, again, and just as Brianna mentioned, we have ethics, we have confidentiality. There are so many different things. It can be hard sometimes because it's not like being a teacher where I can come home and talk about all my students, or, principal was getting on my nerves today, or whatever the case may be, right? So sometimes it can take a lot of decompressing. I might have to just go and shout in a hole outside like Iyanla does or something, or just a lot of inner work, right? Like that self-inventory. And then just, again, maintaining those things. I don't have a therapist right now currently. And it made me think about something that you mentioned earlier, Janae, with like the dating or just kind of breaking that connection with your therapist. And again, I went to my clinical supervisor to let her know, like, this is what I'm feeling with my therapist in our sessions right now. And I think it's appropriate for us to terminate. But going to therapy as a therapist is probably one of the most beneficial things that we should do. Like, it shouldn't even be up for question. And again, just kind of like maintaining my own spiritual and wellness practices, especially when there are things that are just very heavy and traumatic, because that stuff can sit on your spirit. It can sit on your emotions. Like, you'll think about those things. So you have to have practices and techniques that just kind of help you, again, to just decompress and just kind of clear your mind and just your energy and your spirit as much as you can. And also just like knowing when to kind of lean on friends. Like, you can say, something triggered me when I had a session with a client, and it made me think about something that happened to me as a child. And then we can kind of make that safe space as friends to talk about it. I'm not breaking confidentiality, but now I'm taking my own things, right? Because I was able to identify, like, okay, this particular thing, it really set me off. So I need some TLC. We need to go to Chipotle or something, like, you know.
Food does heal. Thank you.
I agree with, everything that's been said. It's really helpful for me to hear, again, as a student, that you all are also triggered in your sessions, because I think that something that isn't talked about a lot, at least in my program, is the idea that, like, yeah, we're human, and that the therapeutic relationship is still relationship. Like, you're connecting with another human being, and their stuff can be put onto you. I mean, that's that's literally the whole field. So I think it's helpful for me to even hear that, and to have permission to feel triggered in sessions, because sometimes I do. And the weight of it is enormous sometimes. I would say there's days where, like, I'm going from class to then going to teach, and then I have a session. I'm like, oh, wait, I didn't eat, and now I need to hear this person, talk. Oh, they triggered me, but I have homework, so I've got to put it to the side. So I think, again, having that support system, as you all mentioned, and also having or knowing ways that you can care for yourself and heal is really, really important. I've been really fortunate to have a great, great, great cohort. 3 of us actually live together, so 3 out of the 4. So we're very close. Having them to lean on, having people in the field who you can relate to has also been really helpful. Supervision. And then having, I guess, a network of other mental health professionals that look like you has been really, really, really important, and something that I wish I had done a little bit earlier in my schooling. But having people to lean on, to learn from, okay, I'm dealing with this person in a session who doesn't look like me, and they're making me feel a certain way. How do I deal with that? Because our school curriculum isn't going to teach people of color how to deal in those situations. So I think all of that has helped me kind of stay grounded.
Yeah, that's so important. Because you're learning, you're in the program, right? And then you got to get out and get into practice. But you need that community of folks that are doing similar work to keep going, because it is a lot. You all are carrying a lot, and it can be triggering, right? But you also need that space to be supported by your community as well. And so we think about that support that's needed. How can we create more supportive and inclusive workplaces for mental health professionals, particularly for those that are underrepresented or marginalized?
I say, honestly, funding. I truly believe that, especially here in the United States, like, you put your money where your mouth is. There needs to be more funding, more economic support that goes towards mental health, because I truly believe that if there were more resources with capital to maybe subsidize like salaries and pay and supervision and exams and all these things. It can be a cushion to help, right? Because then at least it can minimize at least one piece of a challenge, a struggle, or whatever. And then also like just exposure, more collective encouragement, and of just like gathering communities, even things like this, right? Like we have an audience that's listening and maybe sharing stuff on social media, and really just kind of pushing for that community of togetherness when it comes to healing. And one thing, especially that I love about the MSK programs, are the peer support groups. I wish that like it can be implemented everywhere, because even if it is for an hour and a half once, every other week, having Black women that can come together in a safe space to share different walks of life and experiences and all that, it is therapeutic, right? And even just like these little bubbles, we can connect more people to say like, okay, well, I know a clinician, or I know somebody that knows somebody, those kind of things, I believe. But there needs to be more funding put into support for mental health, specifically for Black women, because just like you said, Black women are highly, and not just from other Black women, there are non-Black people who are specifically seeking Black women clinicians. So yeah, we need a lot of support.
Most importantly, with the coins.
That's what I was going to say. I was going to say everything that popped up in my mind at that time, the base of it is still, like she said, funding. So even thinking about, just having trainings or having a mental health professional come on site, monthly to just do a check-in, or provide some type of psychoeducational group, maybe allowing them to express how they're feeling, or feel heard and understood. So I think that is important, because if like, we have to start looking at mental health as like the same way how we look at like medical, right? So if we're not feeling well, we're going to go to the doctor. If our leg is broke, we're going to go to the doctor. So agencies and community organizations and other facilities need to start looking at it in that same way. Like, in order to have staff that are effective and giving their best, we have to, give them check-ins, right? Even if it's like once a month, once a year, a retreat, maybe like having a mental health retreat, all of those things, because even when we don't express it, on the inside is where the mental health and stuff is. So like I said, with the broken leg, somebody has a broken leg, you're going to try to help them. You're going to say, oh my gosh, let me open the door for you. Let me do that. But with mental health, because people can't see it, they don't feel like it's necessary or important for them to address immediately.
Yeah, that is so real, Quadisha, because again, it's an eternal experience that folks have, and typically you only see the manifestation of some of those things if it's not being addressed, that show up physically and things like that. But that's right, because if I'm stressed, I don't see nobody sending me no Uber Eats, I don't see nobody offering to come do X, Y, and Z for me. I got to be like, hey, y'all, I'm down and out. Can you please? Which it shouldn't be like that. Brianna, did you have something to add? I'm sorry.
Yeah, I was thinking about funding, because I think that I don't know, as a grad student, funding is always helpful. But I was also thinking about funding, I guess, in a different way too, because there's I worked on this project where they had this kind of model, or this question that they would ask, and it was taking that adage that's like, it takes a village to raise a child, but then they would ask like, but what does it take to raise a village? How do we create a community that is supportive and that is warm and uplifting? And so I think about when I was younger, and there were so many STEM programs, like this is like mid 2000s, I guess. You had to play with the little robots. You had to like do, I don't know, just all these different programs. But what if there was something for social, emotional, or mental wellness, or something instilled that early, to where people know, like as Quadisha was saying, like, what a doctor is. I mean, you know what a doctor is when you're 4 years old. Why was I 19 when I learned what a psychologist does? And I think that if we knew that earlier, if people knew about this career as something that could be pursued, people knew about the need, if people knew that there is a doctor for mental health, that could help a lot with creating that village of just a culture of mental health that is helpful, supportive, especially for Black women.
Yes, that is so real. Yes, because you don't see that. Like, of course, like when you're 4, you know you got to go to see the pediatrician. You know you get a little lollipop. You know you got to get your shots or what have you. But at that time, you don't know. A mental health professional is not coming in the room to check. You know, if you're feeling depressed at 4 or anything like that. But you need that. We need to be introduced to that early. And you know, we're seeing a lot of folks trying to channel that in their parenting as best as they can. But you're right, the exposure is needed from the very beginning, as well as the funding to support those initiatives and things like that. Um, I was just going to also say, because Mbacha, yes, she is a peer support group facilitator for our MSK Heart Health program, which is all about Black women protecting their heart, both physically and emotionally. And the support groups are for that purpose, to say that you can't do it alone. You need that support. But also with the program, we have a Sis We Got You therapy fund. So folks that are enrolled into the heart health program, they can select to receive financial support to cover copays for them to go to some sessions. And we found that to be helpful because folks hadn't even thought about it. And they would say, like, oh, well, this is going to be helpful for me, even though that is focused on lifestyle change and things like that. But it's been really helpful to be able to support folks in that way. Um, so yeah, this is an important conversation. I'm just happy that you all are contributing and doing what you need to do from where you are. I want to ask each of you this. What has been the most encouraging thing someone has said to you or done for you that keeps you going in this field? I know it's something to think about, but you know, because it may help someone else. Like someone says something encouraging to you that stuck with you, they've done something for you that's really stuck with you, and you carry that as you're doing this work.
I'll go. So there's so many things, but I even had one today, but I ain't gonna talk about that one. Two main things that I've heard being in this field that kind of keep me going is, number one, remembering my why. Like remembering why I even started this in the first place, and who I want to help, and what my future goals are. That one keeps me going every single day when I feel like I want to give up or I'm overwhelmed. I'm always like, nope, remember your why. And I even have it written down, so even writing that down, so that whenever I am feeling like that, I can look over and be like, that's why. And then it gives me the motivation to keep going. So remembering my why. And then the second one is that you can't pour from an empty cup. Hearing that from someone else, like, what? You right. You can't pour from empty cup. If I don't have anything to give to you, if my cup is not full, or I'm not putting the things in my cup to fill it up, then how am I supposed to help fill your cup up? So for me, those are the two things that always stick with me when working in this field.
Love that, Claudia. Thank you.
I do love that. One thing for me would definitely be just like the drilling of self-preservation from the elders and just like the professionals in this field that I've been surrounded by. And then also, there's always that one point where you have to submit your tape to your clinical supervisor so they can listen to your session and evaluate and everything. And honestly, receiving just encouraging and constructive, like helpful feedback, and knowing that like my clients, they notice change within themselves. It was just, that's those two things for me wrapped in one. That's my answer.
I think for me, and I don't know where it comes from, I think it's just been kind of hammered in as I've gone through graduate school or just gone through life, but just this idea that caring for ourselves is this act of resistance, that we feel the way that we do when we feel down. It's all by design, and being able to disrupt that through clinical practice, being able to disrupt that by using clinical practice or psychology as advocacy is something that keeps me going. It's like, okay, yeah, I am fighting for something. I'm fighting for something that's so much bigger than myself. I'm fighting against something that's so much bigger than myself. And that really helps sustain me.
Yes, I love what each of you have said. That is so important. And I hope that that encouragement that was given to you all and that's sticking with you encourages other folks. And then that goes into my last question for you all. What advice would you give to someone who is considering a career in mental health or who may be struggling with their own mental health while working in this field?
I would start with getting into therapy yourself. And again, sometimes it can be a process. Sometimes it can be stressful, but that is the very first thing that I can suggest, because you have to know how it feels to sit on that other side, right? You have to know what it is like to find your triggers or talk about your trauma and all these things. And you also have to know how to identify them, because again, when you are sitting on that side with your notes and you're receiving these things and something comes up and you want to react a certain way but you can't because you're the one giving the client the tools. um I think that is the first piece of advice. And I would also just encourage it, because I can't remember if it were Brianna or Quadacia that said earlier, we're all doing this for a reason, right? And so if someone else wants to become a therapist or a mental health professional, there is a particular reason as to why they're doing that, right? Do your research, right? Everybody is going to have a theoretical orientation or something that fits them, and make sure it's for you, right? Like you'll find out. And then the last thing, when I was talking about like getting in therapy yourself, like when I'm saying you have to know what it's like to be on the other side, in my program, it was mandated for us to be in therapy before we could even see a client. Like before you even get a signature for your internship, you had to have signed off a certain amount of sessions. Because again, we have transference and countertransference, right? You don't want to put something onto your client, and you want to be able to identify or recognize if your client is projecting or putting something on you, because those things can create emotional entanglements between the sessions, right? And that's like one of the last things that we want. But I'm encouraging so many more people to get into the field in whatever capacity, because there are so many things. If you don't want to sit face to face against or across from a client, you can do psychoeducation. You can teach people how to literally use therapeutic tools to heal themselves and other people. Janae mentioned mental health first aid. I didn't even know about that until I got in my program. That's another amazing route to take too. So, yeah.
Love that. Thank you.
I think that was good. That was really good where you talked about like just doing your research before coming into the, into the field. You say, oh, I want to be a therapist. And then you don't know it's all these different kinds of therapists and, modalities, treatment modalities and, all of that type of stuff. So just definitely doing your research this is what I would say to a new therapist coming in or somebody who wants to be a therapist. Also have an open mind, because the stuff they teach you in school, like, you can know every diagnosis and everything, but all the book stuff. But once you get in front of a client, it's totally different. It's no script to therapy. You just got to kind of go in there and give it your best. So, not thinking that everything has to be scripted. And then, not trying to save the world, right? As new social workers or therapists, we come into it like, oh, I'm going to help everybody. I'm going to change the world. And, slowly after that, you begin to realize that it don't happen like that. You got to maybe do the each one, teach one to be able to reach a bigger audience. But as long as you are doing your best and reaching at least one person, or trying to, then so just remembering that you can't save everybody's. And then for a therapist that's already in the field that's maybe struggling, just like she said, seeking therapy, or just doing more self-care to prevent burnout. We self-care is not a luxury, it's a necessity. And so just kind of keeping that mindset of just pouring into yourself, and that's what I would say to them. Thank
Yes, love that. Brianna?
Yeah, y'all basically hit it. So I think I was just gonna continue on saying to stay open, and to stay authentic to who you are. I think that that's something that I'm constantly learning and relearning, is staying authentic to myself in session. Like Quadesha was saying about, like, yeah, they teach you by the book, but then that book often doesn't fit people who look like us. So when you get into the therapy room too, the way that you're going to engage with the client isn't going to be that standardized treatment model, because that's not who it's standardized on. So I think staying authentic to what you believe healing is, what it takes to heal, and who you are and how you show up with other people, how you connect with others, is really important. Staying curious about the field, staying curious about people in general has been something that's really helped me, and being open to understanding people from different angles, being open to being inspired from different things. Like, I gained inspiration, yes, from reading the literature, but also from my mom or from my friends or from people around me. I think that openness and that curiosity carries on into the therapy room as well.
Yes, I love that. So I just want to say thank you to each of you, Brianna, Quadesha, and Botcher, for this amazing conversation. You all have been dropping gems. I see the comments, so I know folks are appreciative of all that you each of you have shared from your respective places, and of course, we at the Black Women's Health Imperative appreciate you all as well. For those of you that are in the audience, stay tuned. We have another MSK Week panel tomorrow. It's entitled Sis, You Got This. So we'll be featuring and talking to some folks about their realities of being a professional, but then also living with chronic illnesses and management. So again, thank you to our amazing panelists sharing their insights as mental health professionals, and for you all in the audience for joining us in the conversation and being supportive of these amazing Black women. With that being said, we are out because we're going to take care of ourselves this evening. Peace, y'all.
Bye.
you. Bye.